are from Delhi?
I am basically from Goa, now settled in Mumbai.
Oh, wow. Amazing. Okay.
And where
So
are you from?
amazing. I'm from Delhi, currently staying and practicing in Noida. So it's just very at the border of Delhi.
Okay, it's very hot, right?
Today it's a very nice weather. It's
Oh,
about to rain, I guess.
oh wow, that's nice. It's very hot in Mumbai here.
Okay, and now like Diwali is coming up, so we are having a very pleasant weather nowadays. So it's little chilly.
Oh, nice to know. It's very, very hot here in Mumbai.
Could you please share about your background a little, like your college and bachelor's year of admission, how you end up into BAMS?
Okay. So my name is Dr. Sheetal Desai and I am an Ayurveda practitioner. So my journey started in Ayurveda just like all other students. Like everybody takes Ayurveda. The main reason, like if you ask everyone, it's basically like we wanted to get into MBBS or I wanted to do dentistry. So I couldn't qualify and that is the reason I got into Ayurveda. So my thing was little different. Like I was never into medicine, like most of us. I wanted to do masters or maybe B Pharm or something. But my dad was a keen follower of Ayurveda. So he was somebody who was like, अरे चलो तुम्हारे marks भी अच्छे हैं तो जाते और medicine कर देते, right?
Right.
So when I started, so it's, I guess it's similar to everybody, right? Because when we are in our 11th and 12th standard, we are not that mature to understand or we are not that confident to, we are unsure about our career paths, right? So just like other students, I was actually pushed into Ayurveda, but I ended loving Ayurveda.
Right, exactly. Same happened with me. I ended up in dentistry, but yes, ended up loving it even more. So, what subjects to take when we want to pursue BAMS, especially in 11th and 12th, like after if we are deciding it. So, what subjects to take and what exams to clear after 12th?
Sure. So it is similar to most of the medical sciences, if you know, right? So in India, the major medicine fields are basically your MBBS, BMS, BHMS, BDS, and I guess BNYS, that's the naturopathy. So for all combined, the basic criteria is you have to take physics, chemistry, and biology, right? So these are three basic subjects. And if you want to get into medicine, you can quit maths. Maths is not needed. So you can easily quit that and take these three main subjects apart from your languages and all. So that's the basic criteria which is needed and which is what I have also passed. So basically when I started out, we had something called a CET or the state examination. Now it is NEET and I guess every state has its own exams, right?
One is a common exam that happens. I guess that's what NEET is. But
Yes.
yes, there are some colleges which happens for individual. Maybe, for example, AIMS or some institutes have their own as well.
Correct. So like for example, I passed out from Goa. So for me, I had something called as Goa CET. So that was basically entrance for colleges in Goa. And if you want to look out of colleges, because if you look into Ayurvedic colleges, there are around 200 plus Ayurvedic colleges, out of which 50 would be government colleges and 150 plus would be private colleges. So
Okay.
basic thing as we started, I would talk more about my experience also. So
Yeah.
basically, we start with physics, chemistry, biology. So you clear these exams. Every year the cutouts are different. So they say it is minimum 50%, but it all depends on the cutout for every year because students are very smart, right? 50% of what come hota hai, they always talk about in 90s and all,
Yeah.
correct?
How do you know if BAMS is for me, as in any student?
Okay. This is a tough question. And also, when you had actually messaged me regarding the live session, I have normally not been doing a lot of live sessions now because of a lot of other commitments as such.
Yeah.
But why I chose to do this live was because of the subject was very interesting, right? And this is a common question which I and most of the Ayurvedic doctors receive in our DMs most of the time. Like, is Ayurveda good for me? Is there any future in Ayurveda? Like, how do I choose Ayurveda? Or my parents are against Ayurveda, right? तो
Yeah.
आपको भी ऐसे questions आते रहेंगे regarding dentistry, I
Right.
assume. True?
Right.
Yeah. Like, for example, as I keep saying this, that Ayurveda is not for everybody. It is not a simple science, right? When we talk about MBBS, you're learning the modern science. But when we talk about Ayurveda, you also learn the modern science and you also learn the Ayurvedic sciences as such, right? So
Yeah.
whenever you're deciding of pursuing Ayurveda as such, you can sit down with your parents, you can do all of your research. One thing we need to understand is it's not an easy subject. It's a difficult course. It's a lengthy and long course, right? We basically Ayurveda and all the sciences are 4.5 years plus 1 year internship. So it's a long course. So when we get into it, we need to understand this. One, it's a difficult subject. Second, it is a lengthy process, right? Because many of my colleagues, when we were studying, like we always had this, like, अरे ये तो graduation करके 3 साल में इसकी नौकरी लग गई, and we are still studying, right? So as I said, Ayurveda is not for everybody. So we need to sit and understand. As I said, it's a difficult science, but it's a very beautiful science, right? What makes Ayurveda different from other pathies is it keeps you connected to the nature. It keeps you, like for example, I always tell this, like Ayurveda is basically like a guide. It's a guide which helps you to lead a happy and healthy life. So it's basically not only a science where you just sit down and write prescription and patient को आप दे देते हो. It is basically more where you are into that process of healing, where you're spreading the awareness, where you're teaching people to stay connected to the roots. So if you're
Right.
somebody who wants to learn something or who wants to preach something which is beyond writing prescriptions or beyond calories, then yes, this path is for you.
Okay. Got it. So I guess
Mhm.
Ayurveda is how to live your life basically because that should be how it is. And I'm very much into Ayurveda. I mean, it should, if we practice Ayurveda, like the small changes to know your body, to know the basics of your body, then I guess we can live well. And it's not just, exactly like you mentioned, it's not just writing prescriptions and curing. If Ayurveda is practiced as a preventive think that's a much more, I guess, healthier and happier.
True, true. And I always say it starts from within you. So whenever you are going to preach something, you need to practice it on yourself, right? From all the
Yeah.
detoxification treatments and therapy. So you should be ready to practice Ayurveda, to preach Ayurveda.
Right, and I guess ये तो all Ayurvedic doctors can do, but if we are extracting a tooth, a very difficult tooth, that doesn't mean I have been through that journey. जरूरी नहीं है I have also been through the braces or through the extractions that I can understand the other perspective of the patient. But Ayurveda is something that we can actually inculcate and then share it with the other people as well.
Exactly, because as I said, it is like we divided into two parts, right? Illness and the wellness aspect of Ayurveda.
Yeah, yeah.
Treating a person, like in Ayurveda, the definition of health itself is when we are, or when we talk about Ayurveda, Ayurveda itself says it's not only about treating disease, it's also preventing diseases. So that's also main aim of Ayurveda.
Right. So, Doc, what are the subjects? You have mentioned the number of years. What are the subjects, and do you have how the exams are, theory, practical, and what are the challenges of the course of BAMS?
Sure. The first year, as I said, it's just a 4 year course, 4.5 years, and 1 year compulsory internship, just like how you have in dentistry or MBBS.
Right.
What makes it difficult is basically the first year, the transition period is a bit difficult. Because when we are in
Okay.
a 12th standard, we study about physics, chemistry, molecules, all of that. And when we come into Ayurveda, the first subject which we learn in Ayurveda is Sanskrit. And
Oh,
that is,
okay.
yeah. And that is what I feel is very difficult, because here you're learning a new subject, you're learning a language to learn in Ayurveda. And that I find is the most challenging, because we have been studying in English or we have been studying in Hindi, and now you are learning a whole science which is written in Sanskrit. Like most of the books, like everything about Ayurveda is written in Sanskrit, but yes, it is translated in English, it's translated in Hindi. But the
Hmm.
first year we start with basics is learning the language. But watching a Korean movie with English subtitles, and you are bound to miss out on a lot of things because you don't know the language, right? It is
Right.
not compulsory to know the language, but it helps you better to learn the science. So if you are somebody who is interested in learning Ayurveda, so after 12 you have that बीच में एक दो महीने का जो gap होता है, right? You can
Yeah.
try to learn थोड़ा सा संस्कृत languages, अगर language आप सीख सकते हो तो बहुत helpful हो जाता है. And that is the most difficult part, because you have to by heart shlokas, you have to read in Sanskrit, right? तो
Oh
वो होता
wow.
है
Okay.
subject जो एक आयुर्वेद
Yeah,
तो
I
like
remember Patanjali because I learned Sanskrit till eighth. So just
okay.
the basics, yes.
Yes, so you don't have to master the language,
Yeah.
but at least if you can understand the basics.
Right.
Okay. So apart from that, what we study in our first year is your basic thing. What you also study is your anatomy and physiology. So there's two subjects. And what is challenging is here we are learning the modern aspects. So we are reading the same books what an MBBS reads, like BD Chaurase and all. Apart from that, you learn the Ayurvedic aspects. So you're learning modern medicine and connecting it with the old age-old principles.
Okay. Got
Yeah.
it.
So the first subject basically will have physiology, will have anatomy, Ayurveda history, and as I said, Sanskrit is also very important. And from second year onwards, we start studying about the drugs, about the herbs, about what we say diseases and all. And as we go into the third and fourth standard, we start fourth year, we start studying about diagnosis, treatments, therapies, seeing the patients and all.
Okay. Got it. So you have to write the exams in Sanskrit as well?
Not needed, but most of the shlokas you can write it in English. But basically, if the shlokas what are very important, and like when you're studying, you find it little silly. Like why am I by hearting a shloka, right? Because
Right.
all this year you are talking about something else, and now we are talking about things like vata, pitta, and kapha.
Yeah.
But as you keep going to your second year, third year, it all starts making sense.
Mm-hmm.
Like, for example, till today, whatever I have learned in my first year in a shloka form, I still remember, and it's very difficult for us to forget things
Yeah.
which we learn in a poetic form, right?
Right.
Like, for example, if somebody asks you a song, like a 80s ka gana, to we don't forget the lyrics, right?
Right. Right.
So it
Correct.
all makes sense later, but वो शुरू में लगता है यार क्या कर रहे हैं हम लोग, क्या
Yeah.
बाय हार्ट कर रहे हैं, क्या हम संस्कृत सीख रहे हैं.
Right. Got it. So, what can be the scope of BAMS in India and abroad after your
Mm-hmm.
graduation here?
Okay. So as I said, when you are in this 4.5 years, your main focus, like I forgot to add, you had asked me about the
Yeah.
exams also. So
Yeah.
exams are similar. You have your theory exams, you have your practical exams, and you have your viva. So practical exams are basically identifying your bones, understanding the system, taking history of the patient, doing the treatments, doing the therapies, all come into the practical aspect. And theory exams are basically, we have theory exam at the end of the every year. So once you cross 4.5 year, uske baad you are qualified or you are a graduate. But you get the degree after completing the 1 year ka compulsory internship in a government hospital and an Ayurvedic hospital. So once you complete that 4.5 and 1 year ka internship, you are qualified to be or you are qualified to practice Ayurveda. Okay. So here
Got it.
comes what is the scope of Ayurveda. If you had asked me this question like 7 to 8 years back, there was very limited scope to Ayurveda. But thanks to Ayush Ministry and thanks to, I feel, most of the Westerners or foreigners taking keen interest in Ayurveda. Just how yoga bloomed, Ayurveda also started blooming a lot in abroad compared to what it was many years back. And it's actually a bit of empathy on our part that most of the Westerners follow it religiously compared to Indians following Ayurveda.
Right.
Right? So coming,
घर की मुर्गी
uh,
दाल बराबर.
exactly, ghar ki murgi dal barabar. But now people are taking interest in it because the Westerners are practicing Ayurveda.
Yeah. Okay.
Okay. So, so coming to the scope part, one thing as I said, the common route which everybody takes it, doctor ban gaye, abhi clinic start karo, right? But there are its own struggle of starting clinic. So I would normally recommend you, if you want to get into clinical practice or anything, what you can do is you can join a doctor's clinic, or you can join a professor's or your teacher's clinic right from the second year or third year if your goal is clinical practice, right?
Makes sense.
Because
Wow.
what happens is, what we usually do it, चलो डॉक्टर बन गए, अभी मेरे लिए तो पेशेंट ही पेशेंट बाहर बैठे हैं, मैं क्लिनिक डालूंगा और लोग आ जाएंगे.
Right.
Right? And truly, that is the reason it is called as practice, because it takes years of practice to build a practice, right?
100%.
So do not expect this. You'll start a clinic and there will be 1,000 patients standing outside. So you need to practice when in your college. So that is one thing. Second thing is, before starting out your clinic, you can always work under an Ayurveda practitioner. There are a lot of Ayurvedic practitioners who are doing so well in their field. So you can start interning with them, or you can just start as an observer with them. So just stand, even if you don't understand anything, just keep observing things like what are they prescribing, why are they prescribing, ask questions, right? So that is one thing where you can join clinics. Second thing is, there are a lot of Ayurveda centers, there are a lot of Panchakarma centers in India, especially if you go into the southern part of India, or if you go to Kerala and all, right? So there are many centers where you can join. Yes, the starting salaries are not that high, but once you start growing into that field, you will make a lot of money in this field. So this is just with plain BMS. So once you're a graduate, yes, you have right to practice. So you can join a clinic if you're that confident, like if you have a background, like your parents have a hospital, or if you know somebody who runs a hospital, yes, you can go and join them.
Right.
The other things what you can do is join a hospital as an RMO, right? RMO is not related to Ayurveda, but you can join in hospital and do a MO-ship or RMO-ship. That is also will give you a good start. Like for example, in cities like Mumbai, even though you learn Ayurveda, you can practice other pathies like allopathy, but under a guidance of an allopathy doctor. So that is what you can do. Third thing, if you want to be a professor or lecturer, prepare for master's degree, prepare for MD. You cannot be a teacher or professor just with plain BMS. You need to have that master's degree.
Right.
Correct. So other thing, as I said, for abroad also, Ayurveda is not considered as a medicine pathy or a mainstream of medicine in most of parts of our country. Like there are many countries who just look into Ayurveda as alternative medicine system, because most of the herbs and drugs are not easily available in most of the parts of the world. So many countries look into Ayurveda as an alternative medicine system. So yes, you can practice Ayurveda abroad, but there are a lot of limitations to practicing Ayurveda abroad, because there are not many herbs and drugs. Also, there are not many researches done on a lot of things. So there are limitations. It is not impossible, but there are some limitations.
Got it.
Mm-hmm.
And if we want to pursue masters, how many branches are there in Ayurveda?
Okay, now for example, many people don't know this about master's degree and all. So after finishing Ayurveda, you need to study for 3 years for masters. So we say MD and MS. MS is masters in surgery. MD is your masters in doctorate. So you can do, I'll talk about MS first. You can do master in surgery. There are subjects called as Shalya, which is basically your general surgery. And the other subject is Shalakya, which is your ENT. and then it's your gynec. Gynec is your basically stree rope, which is gynec. So you can do MS in this. Like
Okay.
2 to 3 years back, there was a lot of recall with there were many doctors who were opposing Ayurvedic doctors कि अरे आप लोग कैसे surgery कर सकते हो या how can you perform surgeries and all, right? But to perform a surgery, a basic Ayurvedic doctor cannot perform a surgery. But if you have done an MS, you can perform because again you are studying both the paths. You're also studying modern science and you're also studying Ayurveda. So you're
Right.
using two sciences to treat people.
Yeah.
And in general masters, you can do masters in internal medicine, you can do masters in pediatrics, you can do masters in Rasa Shastra, that is your herbs and all. You can do masters in yoga, you can do a lot of subjects.
Okay. Got it.
Mhm.
And we can do MD if we have done graduation from India. Can we do the MD from abroad?
See, actually, MD in Ayurveda is not available abroad, not many. But if you want to do MD, I would recommend you to do MD in India because there are so many
Exactly.
beautiful colleges in India. And it's an Indian science which has Indian origin. So I wouldn't recommend you to do masters anywhere else from India.
Exactly.
And there are many foreigners coming to India to learn masters or to learn
Right, right.
Ayurveda.
So is a master's degree a must after doing BMS, or it's fine being a BMS?
It actually depends on your goal, as I said. Like if you want to do
Hmm.
clinical practice or if you just want to practice on a day-to-day life, MBA is not a necessary, it's an added thing as such. But as I said, if you want to do research in herbs or if you want to do if you want to be in clinical research, if you want to get into it, master's is an additional degree. Or if you want to open a lab, right? So for that, you need that degree. Or if you want to get into, as I said, many of my friends want to become a lecturer, want to have that life of becoming a teacher. So for that, master's degree is must. But if you're somebody who just wants to practice Ayurveda, there is no limitation. Master's degree is not necessary for that.
Right. So do you have any myths on BAMS as doctors or your industry? Like dentistry has their own myths कि दांत कब निकालना चाहिए. Patients में बहुत myths है. So do you have your own myths which are very common among your industry and doctors?
A lot. मुझे लगता है पूरा दिन
Okay.
निकल जाएगा.
Okay, okay,
Talking
okay.
about it, like
Can you share
very
just
common myth.
few? Yeah.
Like for example, very common myth, one thing which normally people have is, first thing is Ayurvedic medicines have a lot of metal in it. So it will cause a lot of toxicity. So this is something which is very commonly told to me by patient कि अरे आपके medicine में metal तो नहीं है, right? So is it safe for me? Is it safe for consumption? So I'll just keep telling this to people. Ayurvedic medicines do have metal, but in not all the medicines. The metal used is in purified form. It is not that you are putting the direct metal, right? It is purified. It is researched well, and that is when we are prescribing it. We're not just giving you metal for consumption, right? So ये बहुत common myth है, and specifically this is something which is spread mostly by the other doctors or the other pathies, sadly.
Right. And do you have a myth such as some Ayurveda medicines or products do have a bone pieces of maybe animals or some bones of other animals or maybe etc.
It's a controversial topic to discuss actually.
Uh,
We do have medicines which do use, but it is all what we say, it is all cleansed down and it is used in a purified way. So it's basically you're not directly using metal or using bone directly, right? It is all
exactly.
is used purified, but and I would say that would rather be just 20 to 10 to 15% of medicines. All the other medicines are herbal, and most of the doctors today prefer prescribing herbal medicines over the other medicines, and we only use it in
Few.
emergency
Yeah,
conditions.
yeah. So, right. So, and how to start a successful practice after BMS if one does wants to go into the clinical practice?
As I discussed before, start attending clinics as early as possible because, as I said, during the first year, because you're just into the transition period of getting, matlab you're transiting into from physics, chemistry, biology to learning Ayurveda, right? So from the first year itself, try to stay in touch with your seniors or contact your professors and start joining clinics in the afternoon or evening. Apart from that, if you want to start a practice, always do your research well. Research about the area, research about the place, because like for example, a place like Mumbai, practicing Ayurveda in Mumbai is different compared to practicing Ayurveda maybe in Kerala, right? So there
Yeah.
are a lot of challenges. And when I say challenges, if the patient is also a challenge, right? If you see in Mumbai, everybody is in hurry. Nobody is going to wait like, अरे 15 दिन के बाद result आएगा, 20 दिन के बाद result आएगा. So you need to modify what you are prescribing, or if you have to modify your science. Like for example, prescribing anything or telling something to a patient in Kerala is much easier because they know a lot about Ayurveda. When you start practicing in Mumbai, we have to start educating the patients first
Correct.
because there is very less or limited knowledge about it. So research work, join a clinic, and for example, for students now, it is such like चीजें बहुत easy है. Now there are so
Yeah.
many doctors spreading, इतना सारा information material है वहाँ पे. Like for example, when I was studying, there's nothing called as Instagram, right? There was no
Yeah.
YouTube, there was no Instagram. So whatever knowledge we received was from the books. But abhi there are so many doctors doing wonderful job on Instagram or YouTube where they're spreading so much knowledge. To try, मतलब कोई वेब सीरीज देखने के जगह पे कोई पॉडकास्ट सुनो या कोई इंस्टाग्राम पे वीडियोस देखो जहाँ पे they're spreading such a beautiful message about all these pathies.
Right. And doc, in my industry also, जैसे every doctor, there are all types of doctors. So एक doctor कोई बुरा है तो that doesn't mean the whole industry is bad या फिर सारे doctors बुरे हैं. So I have seen and have personally worked with few doctors which I do not deserve to be called a doctor. So how to become a good BAMS?
Actually, again, as I said, like Ayurveda is not for everybody, right? It's a difficult path, or I would say even dentistry, right? It's a
Right.
skillful profession. I always believe dentistry is a skillful profession. And it is not for everybody.
Yeah.
There are good doctors and there are bad doctors. So I always think that, as we say, there are a lot of opportunities. You have clinical opportunities. You also have non-clinical opportunities. So if you feel that you're not good at what you're doing, do not do it. Like, for
Yeah.
example, give justice to the science. Like, there are a lot of other non-clinical things also which you can perceive if you feel you're not giving full justice to the science, right? The other things like medical coding, medical scribing, there's medical writing, there are a lot of other things which also a medical graduate can do if he feels that he's not good enough to do a clinical practice. And I think that's not end of the world, right? If just because you cannot practice, that doesn't make you a bad doctor. Because as I said, it's a difficult science. So you need
Yeah.
to give 100% to it. So if you're not able to do that, be honest about it and try to find other alternatives or other opportunities in.
And the earlier question that we were discussing, like, patients have a lot of myths. So, they will challenge the medicines. They have the right to. They can ask and even challenge the doctor as well. But, they are saying as if, they are living. Suppose if we talk about Delhi, it's one of the major polluted city in the world. So they are talking
It
as if
is.
everything they are having or drinking or eating, it's pure. It's not just Delhi, but it's nothing is pure, at least right now in the environment.
So true,
I
so true. मुझे जैसे एक कोई चीज याद आई because mostly what patients think is like मैं आपको पैसे दे रहा हूँ so that basically means I'm just giving you money आप मुझे ठीक करो. But I always feel a doctor can only guide you. The other things आपको ही करना है. Diet आपको follow करना है, lifestyle आपको follow करना है. Just because कोई doctor का दवा खा के you're not going to be fully healthy, right? And that is what Ayurveda is. Not just what I prescribe you. It's basically what you do throughout your life.
I guess the basics, most important, if we talk about diagnosis for an Ayurvedic practitioner, is to understand first the body of the other person. एक तो वो उस इंसान को भी बॉडी नहीं पता है अपनी, एंड नाउ द अदर पर्सन हैज टू अंडरस्टैंड इट फुली, एंड उसके
True.
बाद ही डायग्नोसिस होगा, बिकॉज द हर्ब्स विल वर्क इन दैट वे.
Exactly.
So, and also, Doc, I guess this will be my last question. What is the investment to start an Ayurvedic clinic is high,
Mm-hmm.
or
See, it also depends from places to places. Like for example, I live in Mumbai, a tiniest place, you'll have to pay 30,000 to 35,000 rent. And here, if I'm practicing Ayurveda, because if you're running a wellness center, if a person wants to be well, if a person wants to be relaxed, first thing he'll need a spacious place, right? You cannot just tell a person or give a massage to a person in a tinier space. So yes, you need lot of investment if you want to start an Ayurveda center in a metro city like Mumbai, Delhi. Yes, the cost of living is higher. So if you want to start something, I would recommend you one is save that money, like start practicing or start working elsewhere, save that money, and after that only you start. So you don't have to take huge amount of loan to start this, because it will start repaying you back in a year or 2 years. So it's not something you'll start in clinic and the next month you'll start making a lot of profit, right? There's a huge investment because Ayurvedic herbs are expensive, the setup is expensive, you need to have the tables, the chairs, everything. It's an expensive thing. So if you find somebody who can finance you, or if you have 4 to 5 friends who can come together and start a setup, or in Mumbai, there's a system called as polyclinics. So there's a place where
yeah.
you can practice dentistry, you can practice Ayurveda, so you can go through that.
Okay, so in Ayurveda we have medicines, of course. So do we have the
Mm-hmm.
naturopathy comes under Ayurveda?
Naturopathy doesn't come into Ayurveda. I feel most of the what we say थोड़ा बहुत similar हो सकता है, but their path is totally different than Ayurveda.
Okay,
We
got
do use
it.
similar principles, but they're not same.
Okay, got it. Have a very good evening. Take care.
Take care and happy Dashera to everybody. Happy Navratri to everybody.
Happy Navratri. Thank you so much.
Thank you. Bye bye.
Bye bye.